Hey everybody, it's Jackie again with the now newly called Laughter Through Tears, the 120 podcast. I kind of got that idea when my daughters and I did our podcast a few weeks ago, and it kind of occurred to me that, living with chronic conditions and the things that we patients live with, it's kind of necessary to have a life full of a mixture of laughter through tears, and humor kind of always helps me. And I think that my wonderful guest today, Jeevan Mann, will agree with me on that. I'm really excited to have my Jeevan on the podcast today. He is a rare disease patient, and we are recording this during February, which is Rare Disease Month. And rare is rare, guys. Not a lot of people know about us patients. There's not many of us. It's a very, very frustrating thing to live with a rare disease and a chronic condition. And so we are going to honor Rare Disease Month and talk about it. And Jeevan's going to tell us all about his experience, both as a patient and involved in the research in the disease that affects him. And so I want to just thank you all, for coming by again to listen to another episode, and just remind you all that these podcasts are never intended to be medical advice. Remember, if you are experiencing a problem or a medical emergency, reach out to your own doctor or call 911. So anyway, without further ado, I'm going to introduce Jeevan Mann. Is, as I said, a rare disease patient. He's a researcher and advocate. He lives with one of the rarest forms of Ehlers-Danlos syndrome. And after years of being told his symptoms were just pain, he turned that experience into fuel. He's pushing for earlier diagnosis, better care, and real progress for people who live with these chronic conditions. He's currently aspiring to pursue his MD and PhD, and goodness knows, Jeevan, we need more people like you in the medical profession who understand us and who have that lived experience. And he's kind of splits his time between Aurora, Colorado, where he has worked at the EDS Institute, and UC Davis. He has a clear focus on connecting the science, medicine, and the leadership here. Through multiple roles, he's worked in nonprofit and advocacy spaces, and he works to educate others on these rare conditions and addresses microsocial barriers to the medical access and raise awareness overall. So operating between these spaces of advocacy and biomedical research, Jeevan is committed to bringing the highest standard of care to patients and improving the lives of those living with these devastating conditions globally. And Jeevan, I am very excited. Thank you. I want to welcome you to the new Laughter Through Tears 120 podcast. So thanks for joining me today.
Yeah, thank you so much for having me. It's such a pleasure to be on here and to finally get to meet you over the phone like this.
Yes,
Yeah.
I know. We see each other on Instagram, you guys, and we have a real community there. It means the world. You guys mean the world to me. When I'm down, they're some of my biggest supporters, and I try to support all of them as well. So we have a very, very wonderful EDS community, I think, even on Instagram and LinkedIn and anywhere where we can make our voices heard. Um, so I want to get right into it and, hear a little bit about your background on your diagnosis, your EDS diagnosis, like when you were diagnosed, and, were there any unique presentations? And as I think we discussed right before the podcast too, that, a lot of people think that autoimmune diseases or rare diseases affect mainly women, but you are living proof here that they affect males as well. And so, yeah, if you could tell us a little bit about, you know, did that make it hard, for example, to get diagnosed? And, since EDS seems to mostly affect females.
Yeah, thank you so much for your question. And yeah, it's been a real barrier for sure. And I think that I've had a unique experience. And so I've always had medical problems my whole life. So I would say that like ever since I was a child, I would talk about pain. And I think I talked about that in the bio as well. but I was told that that pain was normal and that's something that everyone needed to work through. But learning when I got older that that wasn't the case, and that we needed to start advocating for people with pain and to advocate for diagnoses and for trying to figure out the root cause of these things. And so my journey essentially started. So pain throughout my childhood. I was an athlete, and so I was doing all of these things, and I just learned to not talk about it. But when I was around 12 to 13 years old, I was diagnosed with a brain tumor, and that was after months of really like arduous processes of trying to figure out what was wrong with me. And from that moment, I had a lot more eyes on me in the sense that I was never the typical case of a brain tumor. I had only GI manifestations, and honestly, the only reason that I get to sit here today and survive that experience is because I had my mom and really wonderful advocates who said that even though it's like out of the box, we need to start thinking of other diagnoses, and then found a brain tumor. And so after I got surgery for that, I continued to high school. Thought my life would be normal after a big life changing event like that. But things started to get substantially worse. I developed really severe allergies. I was diagnosed with an autoimmune disease, celiac disease. And then, all these just really weird things started to pop up. And so my mom has been one of my most fearless champions, and she's advocated so much for me. And so throughout high school, she started to just keep taking me to different specialists. And my mom thought I had some type of connective tissue disorder. She was thinking Marfan's because I am on the taller side of things. But eventually, the word EDS came into play. And so my mom had been diagnosed with HEDS at the time. And so my rheumatologist, whose daughter also had HEDS, said that, I think that you don't technically fit the criteria perfectly for HEDS that are set by the 2017 criteria and diagnostics. But I really do feel that you have this. You're just a little bit less hypermobile in some regions than others, but like you can straight up dislocate it. So I'm not necessarily concerned about that, but you do need to see a geneticist. And so from there, I carried the HEDS diagnosis for a bit. And then when I got my genetic testing, everything came back negative. And so I was offered the chance to get whole genome sequencing. And so they said, you might find something, you might not. And oftentimes patients don't. So just be prepared for that. Um, I actually took the phone call from my geneticist in my car when we got the results back because assuming they probably didn't find anything or maybe some gene for autoimmune disorders. Actually, that day I found out that I had biallelic mutations in the gene AEBP1 that had been seen very few times in the literature, but would cause a classical like EDS type presentation. And so then I got the diagnosis of classical like EDS type 2, which is an extremely rare variant of Ehlers-Danlos syndrome. And yeah, so to go to your point, I've never really fit any of the boxes for these things. Even the original geneticist that I saw wasn't comfortable with giving me this diagnosis because she said, like, I've never seen something like this before. You don't look like the patients in the literature. And so we had to find the first author of the paper that published it originally and then got diagnosed there and then also got re-diagnosed at the EDS Institute here in Colorado by our wonderful geneticist here. And so been everywhere. I am abnormal even for an AEBP1 case. I have a lot of HEDS like stuff that goes on, which possibly is from my mother. And even then, I'm not like a lot of the other AEBP1 patients, which may be more a molecular standpoint, just because I have different mutations than they do.
Wow. Okay. This is blowing my mind. First of all,
Yeah,
the brain tumor. Now, I don't think I knew about that. The brain tumor came when you were 12, that diagnosis?
it did. So technically it was 13. So from the ages 12 to 13, I was dealing with it. And so, sudden onset, I developed hydrocephalus from the brain tumor. And so, when my bones were fusing during puberty, it caused a lot of pressure inside of my skull. And so, I developed hydrocephalus, got really sick for the span of about 9 months. And they couldn't really figure out what was going on because I didn't have any headaches. I didn't have anything like that, just was vomiting like 20, 30 times a day and like complained a lot of stomach pain, which was from the vomiting. And so they just kept telling me that like you're stressed out. I was in seventh grade, getting good grades. I wasn't stressed out, and my mom just kept pulling me from doctors. That anytime that they would even question me, they should just immediately pull me out and say like that's not the case. Like no, you need to see a doctor that like believes you and will like advocate for you. And so she really worked towards that until we just got a brain MRI because we wanted to check a box, and then I was in emergency surgery just a few days later. So
Okay, let me first say your mother sounds like an amazing mama bear because I mean, she's got to have nerves of steel. I would be like really losing it. And that's as I was listening to you describe, first of all, the brain tumor and that at first being brushed off as nerves or whatever, and then the extraordinary effort she had to go to and you had to go to get the right EDS diagnosis, and happening to know who was it you said, like one of the authors
So,
or one of the
yeah,
researchers?
Dr. Paul D. Batwell, actually, he was the first author of that publication that came out in 2017. And so, what
Yeah.
was crazy is that he also has a practice in Florida. And so, my parents said that, like, we're not going to play games with this. We're just going to go ask the person who found this, and we'll get his opinion on it. And so, went straight to him. He looked at me, he saw my symptoms, and he kind of just laughed, honestly. And he's like, yeah, very clearly, like, you have this. Like, your geneticist initially thought you had classical EDS, and then you get a classical like type EDS. And she said that, like, you weren't like the other people in the literature who are extremely severe, also because they're 20 years older than me, have different mutations. Like, you can't necessarily compare like that, especially when, like, the domains of the mutation are completely different in the protein. So, like, you're going to have different effects.
Yeah. Wow. The brain tumor, how did they diagnose it? Was it an MRI or?
So that's another funny thing. So I got an MRI and no one expected anything. So like I was supposed to not have contrast. And so I didn't eat beforehand just because I was like, oh, I'll just be careful. But I technically could have, or well, so then they came in about like 5 minutes after my MRI started. They're like, oh, the radiologist changed his mind. Actually, they want you to have contrast. And I was like, okay, I don't really know why you do that, but I'm not going to question it too much. And the second that we got out, essentially, they looked at my dad. They said, "We'll be in touch soon," and that was like very short. And we're like, "Oh, that's interesting." And like by the time that we had driven home, my mom was already there. Like she was supposed to be at work, but so she just was there. She just looked very pale and sickly, and we just watched TV for the rest of the day. She's like, "Oh, I just don't feel well. I don't want to." Because my parents didn't want to tell me until the morning afterwards because I got an emergency appointment with my neurosurgeon the next morning. And so, in my parents' mind, they knew at that point because they had gotten a call immediately from the radiologist because they had just seen everything. And there was pretty severe hydrocephalus. And had I waited a little bit longer, I probably wouldn't have been alive. And so we just watched TV that night like everything was normal. They wanted to give me one last night to kind of live it out, kind of took me to dinner, that type of thing. And then they told me the next morning. And then from then, my life, that's a pretty distinct point where my life changed.
Sure. Oh my gosh, yes. I mean, I'm in awe at how amazing your parents were and how they handled this. Because again, being a parent myself, I know, I mean, if I would get that kind of news, it's sort of like your stomach would just drop to the floor, and your heart with it. I mean, that's,
Yeah,
gosh.
I can't even imagine. Like, I love my dogs to pieces. Like, if they even get a
Yeah.
little cold, like, I get upset. And, like, for your child who you birthed and, like, raised to go through that, I can't even imagine. And even, like, they also selflessly decided to give me, like, one last night. And just,
Yes.
yeah, I can't even imagine what it took for them to, like, try to act normal through that.
Oh, I can't either. But like I said, that I'm just in awe. They're
Yeah,
amazing. And so that was when you were 13 and then you had to have brain surgery, right?
correct. And so I had my first brain surgery when I was 13.
How did that go?
Um, Actually, I was completely fine afterwards. So, like, it was a very short surgery, and then
Yeah.
I came back, stopped vomiting immediately, everything was fine. And I got to have my life back, which was crazy because I mean, I was in and out of school. There's a lot of other stuff with the school not being happy about how much time I missed, and there was just a lot of like
Yeah.
tension during that period where I was just trying to get through it and survive, honestly. And then to one day or to get surgery and then the next day you're completely fine, no restrictions. That's life changing. I mean, besides the fact
Again,
that
mind blowing. Just,
yeah,
oh my gosh. Yeah.
right.
Oh,
such wonderful doctors by my side. I've been so grateful to have them and like for their support through that. It was just crazy to say the least. None of us could have expected that, but that's life. You don't expect a lot of these things, but it's how you're able to get through them.
yeah. And then, like you said, and then come high school,
Yeah.
here comes the pain. And do you think like a lot of this EDS stuff gets um, brushed off like growing pains or something? Like my
Yeah.
daughter was told that. My daughter was actually told she had Osgood-Schlatter disease,
Hmm.
which is that problem with the knees when you're really long boned or something. Is that am I getting that correct?
Yeah. So, I've also heard of Osgood-Schlatters, but
Yeah.
yeah, I also got brushed off where I would complain about pain and I was also in sports and my coaches would just say pain is gain, like you just need to get over it and like stop crying. And like also
Yeah.
part of that was being a male where
Stop
it's like
being
not
a wimp.
acceptable.
Yeah.
Yeah, because I mean, I would cry a lot and people would be like, "Oh, he's overly emotional," which we also know that like EDS, like also emotions like anxiety also come alongside that. But at the same time, I was just in a lot of pain. Like I would wrestle and I'd be like, that really hurt. Like, and they're like, well, that shouldn't have hurt, but like you need to just stop crying. And then eventually, like part of me internalized that where I just stopped talking about it. And so like all these things would happen and I would just not say anything. And that became more of an issue because it's like, you didn't say anything. Well, it's like, well, I was told not to. So
Thank you. If any coaches out here are listening. That was always something that upset me. My kids were all in sports too, and Alexis played soccer and basketball. And at one point, she was just strapping on these knee braces on both her knees
same
and
here.
ankle
Yeah.
braces. And one of her coaches, he kind of looked at her. She came out there. He was like, Lexi, you look like you're going off to war or something because she's got all this stuff on. And like you just said, she didn't say anything about it either after a while because doctors didn't believe her. And coaches would be like, suck it up. You're an athlete. You're not supposed, there's no crying in baseball or whatever. And they really, that's what I really feel for the teenagers who are affected by this. And it's funny too that you all seem to wind up in sports or swimming or dance or it's very active. You're very active EDS patients. Is there any theories on that you know of?
Well, I do know that like for the most part, if we're really flexible, we can excel at certain sports. So like for instance in wrestling, it's hard to pin someone who can bend their back a lot, right? Because if you can just bend and like not really have your back touch the ground, how are you really going to pin someone? And then in football, like I would be able to just do things that others or just a lot more flexible and even like dance, a lot of these other sports where it's sort of advantageous to be flexible, but we're on the pathogenic side of or pathologic side of flexibility where it's flexible, but then you're also hurting yourself and don't know it until later. And that's a big reason why I'm a big advocate in like the age space as well, where it's like, no, like we need to have diagnosis for the patients, but also younger. Like find this or I know that it gets more severe as we get older, but I think that if we start identifying these patients younger, that's going to be huge because a lot of the damage that I've sustained that could have been avoided, honestly, had we known. Like I did not need to be wrestling. I didn't like I have spinal damage from just random things that didn't need to do, and that's a big reason why I'm like so big on that now.
Yeah. Yeah, that's the thing because yeah, I've heard that too, that you're using your flexibility and to your advantage and you can do some of these sports quite easily or but there's damage that's occurring there and you're absolutely right. I mean, we have to get these diagnoses sooner. And also to validate kids because to grow up and not feel like anybody believes you or the doctors are basically telling you it's all in your head or like you said it's just pain and it'll go away, right? Yeah.
It hasn't, but we'll see soon. Yeah.
Yeah. So yeah, something's got to be done. I mean, you're definitely on to something with that. And I think, I mean, we're all behind you with that. The Ehlers-Danlos Society, everybody, we're all crying out for earlier diagnoses. It shouldn't, what was, when I was on that NASDAQ board and I said it took me 54 years or something for my diagnosis. It was 4 decades. It was 4 decades. And when my girls got diagnosed, then I got diagnosed. And I'm a little ticked about it because I feel like, well, I was trying to tell you guys back in my 20s that something was weird and nobody would listen. So,
Yeah, I mean, same thing for my mom. She probably wouldn't have been diagnosed if it wasn't for me, or at least like having to be at so many appointments. And so
yes.
like when I got the monogenic variant diagnosis, then like also the rest of my family started like looking into it more like, okay, maybe this is a real thing. It's not just like your mom.
Mhm.
And then like my grandma, my aunt, my cousin, like, all the females on her side of the family now are looking into this and are like, okay, like this makes a lot of sense because like severe allergies to everything. We all have like celiac disease and a lot of other like inflammatory conditions, but also extremely hypermobile, like blue sclera, things that are just extremely suspicious for connective tissue disorders, but like were never thought about because, oh, like my mom's like this, that's normal, which is not. And my mom and I always like to joke, like same thing, laughter through tears, right? Where I was like, oh, like the reason that I like went for so long is because I had you as a mother. Like I would get geographic tongue from like eating a fruit, and I'd be like, oh, well, that's normal. Or
Yeah.
I'd like do some, I'd get an injury, and I'd be like, well, my mom does that, so that's fine. I'm not gonna go to the doctors.
And we normalize it. We do. And
Yeah.
just so that our audience knows, because I know a lot of people with EDS are going to be tuning into this, but people who don't have EDS, for example, Ehlers-Danlos syndrome is a genetic defect of our collagen, right? That's the jelly-like stuff that sits kind of in between our joints, correct? I'm not the medical person here. I just absorb a lot from medical doctors that I talk to.
Yeah, I mean, it's precisely that, right? Where there's something wrong with our connective tissue, whether that's in the collagen or not, we're still trying to figure out. And so that's been a big thing. There's been some publications that have recently come out saying that maybe it's not even our collagen. Because, I mean, recent studies have shown that like these patients don't actually have mutations in like the components of like the extracellular matrix, but maybe it's something upstream of that that's destroying it. And so, like, for instance, the wonderful Norris lab in South Carolina, they found a gene that is in the immune system and that can produce an HEDS like phenotype. So now it's this big idea of really, is it chicken or the egg, right? Is it the connective tissue or is it something upstream of that? And that's a really interesting conversation that we're having right now.
Truly is. I mean, there's a lot of breaking news that's been coming out. I mean, and thinking that they identified the gene, for example, for hypermobile. Like my daughters and I do not have any of the genetic. So we got lumped into that hypermobile Ehlers-Danlos category, and we have the signs for it. I mean, in the is it the Brighton scale or the Beighton scale?
Yeah.
How Yeah, we tested positive on that and some other things, but there are 13, correct me if I'm wrong, Jeevan, is there 13
So 14
subtypes?
including me, but yeah, so 13 in the
Yes, 14,
2017, but 14 now. So
yes,
yeah.
14 subtypes, all related of EDS. There's, as you said, classical, hypermobile, vascular, there's all these different types and, all the glues that's holding these all together under the same umbrella is it affects connective tissue, correct?
That is correct.
Yes, which is all through our bodies. But yeah, so we have the 13 or 14 subtypes, and I'm starting to stumble here a little bit with all the science. So can you enlighten us a little bit? Tell us about your medical and science background. When did you decide to like go into this type of science?
Yeah, so I'm not a clinician right now. I am just a researcher. And so I would say that it initially started with my brain tumor. I think that I felt really lucky to have survived that incident just because like there's a sense of privilege there, right? Where I survived because my mom advocated for me, and that easily could have been a different scenario. I think that people are in the minority who have providers, medical providers as parents. And so I thought like, okay, how lucky was I to get this diagnosis? And I realized that, from the doctor holding my mom's hand, telling her that he would fix me when I got my brain surgery, to the doctor that fought like to get my diagnosis and to think outside the box. Medicine went outside the walls of the hospital, and they were some of our greatest supporters, not just the people who wanted us to get better. And I wanted to be that for other patients. But when I got diagnosed with EDS, that shook my world in a way that I couldn't comprehend, because with the brain tumor, it's devastating, but you can do something. You can get a surgery, you can be better, there's hope. But with a connective tissue disease, and especially a rare variant, they, were told that, okay, you would have to fight for recognition. You have to fight the medical system on this everywhere you go because no one knows what this is. But also, we can't do anything about it because what do we know? We know nothing about this. And even HEDS back then was one of those things where people would just shrug their shoulders and be like, I don't know if that's real or not. But like now we have the evidence that it's real. We have the evidence that it's prevalent, because
Mhm.
that 1 in 5,000 number that put it in a rare category, what was that actually based on? There's no epidemiological evidence to like actually support that number. But now we actually have epidemiological evidence that says that it's way more common than we ever thought. And so I really struggled with that at the beginning of my undergrad. I was at UC Davis, and I really just wanted to get into the space. And I said, well, I at the time wanted to be a clinician. And I said, well, I want to be a clinician for those patients that don't feel heard, that don't feel seen, because we can do things for EDS. Not to say that the physical therapy and these other modalities aren't helpful, because they are extremely helpful. They took me from a place where I couldn't walk and couldn't do anything to now I can live my life. I still have, things like I'll get hospitalized every now and then, but it can increase your quality of life substantially. And so I went that way, and eventually an opportunity came my way where I could apply to a summer program here at CU Colorado, or CU Anschutz, and I did a Hail Mary thing and applied to it. Ended up getting in, didn't expect much out of it, but someone made a call for me and they asked the EDS lab if they'd be willing to take on a patient who has the condition. And my wonderful mentor took me on. And so I was in her laboratory. And the second I stepped in here, things changed for me in a way I couldn't comprehend. Like, there's something about having hope again, right? Because not knowing what's going on, not knowing anything, it's extremely difficult. And to step in a laboratory where they see you and they also see the condition, that's something that was incredible to me. But not only that, they want to do something about it. And that's one step further where it's like, maybe in 10 years, this won't be the devastating condition that, it is now. Maybe in 10 years, we'll have a treatment that could make us almost like normal people. And I think of diseases like diabetes, like they're devastating conditions, but with insulin, they're manageable a lot of the time. And I think of something like that for EDS, and I can't be more excited. And so, from my internship and from my time here, I decided to try to become a physician scientist and obtain my MD and PhD in the attempt to not only understand this condition in the laboratory and delineate the molecular mechanisms that contributed to this, but also to bring that back to the clinic and bring a compassionate perspective of care. And so that's how I've come forward, and I've been extremely lucky to have fantastic mentors along the way who have supported me and, who hired me to come back out here after my internships were completed. And so I'm just super excited to be going down this pathway wherever it ends up.
Definitely, definitely. And I liked the way that you drew that contrast also, even with, we hear brain tumor, and 99% of the people who hear those two words are going to freak out and go, oh my God, brain tumor. But like you said, luckily in your case, it required surgery and then it was better. Your symptoms were alleviated, and then if people hear the word EDS, first of all, they're going to go, huh? What's that? And though not as much anymore. Not honestly, I run into more and more people who seem to know what that is, but there is no fix right now. Like we kind of self-manage ourselves a lot.
Yeah, and it's like, what self-management is great, and like having that medical care and like ability to do so is, it's very helpful. But at the end of the day, we're still degenerating. Like, age is coming for us all in that regards, where it's like as we get older, it's just one more problem a year. And I I'm here too. Like, I'm worse off than I was a couple of years ago. And like though unfortunate to have good medical care, they can't stop these things from happening because, it's our body fighting against itself. And that's why we need more advocacy, we need more researchers. And because like look at how far we've already come in the last 5 years from a disease that no one knew about to now you say it and people are like, I know that. I have a friend who has that. That's because of advocacy and because of how we're speaking and because of advocates like you. Your Costco magazine reached people that would have, never even saw it. And I remember my internship coming up to me and being like, did you see this? And it's things like that, reaching the common people or hearing about it and being like, that sounds like me. It's,
Well, you
there's
hit the
something
nail on the
invaluable.
head. You
Yeah.
hit the nail on the head right there because a lot of times, and I tell researchers this, through a lot of my advocacy, I get the wonderful opportunity to, talk directly to a lot of these researchers. And I tell them, the work you're doing is astounding. But you guys got a communication problem because you got to get the word out and let the common people, us commoners here, us peasants, leave us know what's going on. And the Costco piece, like I was so excited. I bugged that editor and bugged that editor for almost a year. And finally, Stephanie gave it to me and I was like, I ran with it. And I thought this is going to be good because Costco shoppers, there's millions worldwide, and it got reprinted in other countries, of course, Canada and UK. And, a lot of people saw that. I think they still get feedback from that story that was now going on, what, 2 or 3 years ago now. And yeah, I mean, we have to get more and more word into the mainstream channels so that more people might recognize what they have or what their symptoms might be pointing to so that they can advocate to their own doctors.
Yeah, precisely.
And how challenging was it for you to go through college and, with this condition? Like, did it impair your progress in any way, or what were your biggest challenges in the academic world with it?
That's another separate thing. And so I will say I was privileged, right? I had a lot of parents that supported me, and I chose UC Davis. That was the only school I applied to. It's a university. It's a fantastic university by itself, but
Yeah,
it was also 50 minutes away from home. And so my parents made a deal with me. They said that if you're going to college, you particularly need to be in a place where we can support you. They didn't feel comfortable sending me to somewhere where if something happened to me, I wouldn't have the care I need. I wouldn't have their support. And so we made that decision together. I went to UC Davis, and so uh, I kind of speed ran college. I finished in 2 years, and so I graduated when I was 20. And
gosh,
but
congratulations.
thank you.
It's amazing.
That was only possible because my parents supported me, and like I did AP classes, I did college classes in high school. So I did a year at community because in California you get a guaranteed acceptance to the UC colleges if you to go through community college. But also during COVID, I also had the credits from high school at that same community college, and so completed my year, just did a year there, and then I was able to transfer all my credits to UC Davis. Did a year there, and then I was or 4 quarters, and then I was done with my degree. And so that that was only possible, and it was insane looking back on it because 2 years is really short amount of time. But the support of my community, the support of my professors, and UC Davis is an extremely equitable school. Not only like are they big on education, but they said that you don't need to come to class. Like we'll record the class and you can watch it there. Like that's not a big deal. Or I got
That's
hospitalized
awesome.
randomly, and they said that like you take the time, we'll work with you and try to figure out how we can get you through this. And they did that time and time again whenever I needed it, and I could not have been more grateful. And working there afterwards, I worked there before I came to Colorado, and it was just such a fantastic experience. But yet to say it was hard was an understatement. There were a lot of hardships in between because something every quarter happened to me where it'd just be crazy off the walls, did not expect that. Where I accidentally where I developed a heart arrhythmia out of nowhere. And so like my heart was in the 200s, and I like didn't leave my room for a decent amount of time because I would get up and then I would just feel like I was sweating and out of breath. And
Pound, pound. Yeah.
yeah, which was a lot. And then that same quarter, I found out that I was walking on campus and I just kept complaining that my feet were swollen and that like they really hurt, and got an x-ray. My joints were completely degenerated and turns out I had severe degenerative arthritis. And my podiatrist said like, that's why your feet are hurting. It's because you have the foot of an 80-year-old. And I was like, okay, like that's, thank you. And so like things like that, like they really, like had to take a lot of time to take away from like being at school and just focusing on my health. But luckily, like going back home was a 50-minute car ride, and I was still able to keep up because the school had made, or the way that it was structured is like we didn't need to be there for classes, we had to be there for tests, we had to be there for labs, things like that, where I would work around it. And there was even a period where I couldn't really walk for a little bit, or at least like drive myself and do those types of things. And my dad, God bless his heart, took a week off of work and drove me every single day. So drive me back, wait for me, pick me up, drive me back. Did that every single day
Amazing
until I
parents, like I
was
said.
right. And
Amazing.
yeah, and again, that's also why the microsocial side of things, right? Where it's like these conditions can be manageable with a good system, with good support, but who's really addressing the microsocial aspects of these things? And that's another important piece of the puzzle. And I think that research and advocacy, they're two sides of the same coin. For us to get to the goal where we all want to go and have these patients be as supported as possible and to get to live normal lives, we have to address it from all sides of the spectrum, which is why I try to keep a little hand in everything, even though it's a lot. But yeah,
Definitely. Yeah, yeah, because you're right. I mean, not everybody has the same support system, but with the right support, you can do anything you want. I mean, it isn't, one day I hope it would get to be, like you said, like someone who has diabetes. As long as they are doing their medication and have the proper medical support, they're fine. And I want to see the same thing for everyone affected by EDS one day, that as long as they have the right amount of support to manage the condition and keep going, because my daughters relied on their school. They chose a small school in Pittsburgh, not Pitt, but the one down the street, Duquesne, because it was
okay,
just a small college, under 10,000 students. They felt the small classes would be better. One majored in chemistry and one majored in music technology. And at the beginning of every fall semester, we went to the Office of Disabilities on campus and gave them the updates from the geneticist, and whatever the geneticist said would be their accommodations, like longer time to take tests, or Alexis was and continues to be kind of affected by like background noise. They also had POTS. And so she would take her test in a quieter space at times. And, whatever reasonable accommodation is, like what the ADA says. And that's something that any parents listening to us talk right now, I hope that that's an option at whatever college that their child is thinking about attending, that they could visit with the people at the Office of Disabilities. They're usually really fantastic people, no matter what school you're going to. And I think a lot of schools do have one. Did UC Davis have one? Did you know of? Yeah, they did.
that's where my exams were conducted. Just because,
Yeah.
you know, I can talk right now, but that's not always the case. I have craniocervical instability, I have POTS, I have mast cell activation syndrome, and it's not like a if, it's a when these things happen, and I can't control if it happens during a test. And
Yeah.
so they were aware of everything. They supported me in any way that they could. They worked with my professors to let them know, like, he has medical accommodations, like, you need to do this and that. And my professors were fantastic in those regards. And so, like, disability office, two thumbs up for me. I would give three if I had three thumbs, but
Yep. I feel the same. I feel the same.
yeah.
They truly looked out for the girls. And also, well, this was another piece. My youngest daughter has no problem, absolutely none, speaking up. My other daughter's very quiet. So we really had to work with her on talking to her professors, that you have to let them know, what's going on and where your strengths are, where your Achilles heel is. And and how it can be solved. But there shouldn't be limitations for these kids either. That's another thing, in addition to wanting them to be recognized and diagnosed early and taken seriously. I like parents to know that their child can still do whatever it is that they want to set out to do. They're just going to need an extra layer or two or three or five or whatever's necessary of support to help get them there.
Yeah, no, precisely. And that's what we're working on, and that's what we're trying to move towards. And that's why even these podcasts are so important, just reaching the masses and trying to get there.
Right. And now you had mentioned the, what was it, the micro,
Microsocial.
yes.
Yes.
What, yeah, what exactly are we, because I'm thinking of it in terms of medical access.
Hmm.
Am I in the right ball field there?
So I think of microsocial as like the interactions, right? So like our interactions with each other are microsocial, and like there's macrosocial, which is like the interactions in society. Micro is more so the interactions between other individuals. And so I think that microsocial, like access to care, to me looks like the fact that I have my parents, that the fact that they support me and they provide this level of care that I'm able to use to try to pursue things. But that's not the case for everyone. And I think that how can we try to do that? And that was what my nonprofit was founded on. Like, okay, maybe is that financial? Is that educational? Is that working with providers to try to hope they understand this a little bit better? Is this going on podcasts and educating on like a wider platform? Is this collaborating with other nonprofits to try to access this in other ways? And that is what we really set out to do.
I'm even thinking of in terms of high school, you know, going to speak at like high schools to make the kids more aware so that they can have a more supportive, like, friend network, a social circle in high school, social circle in college. My one daughter, Elise, was very lucky in the circle of friends that she landed in college, who were uh, they were aware of her condition. She told them, what she had, POTS and EDS, and they kind of watched out for her. And I really appreciated that, especially during the COVID times, as you were saying, like it, making sure that they were practicing good infection control. I would never expect this out of 20 and 21-year-olds in college, but they were being very careful. They weren't going out crazy and partying and, getting into these big crowds of kids where they could bring COVID home or back to the dorm or back to their apartment and infect Elise or infect Alexis with it. So, I really appreciated the friend network that they wound up in. And I'd kind of like to see more awareness in our public school systems so that more kids, say if they don't have the, a mom and dad at home, some kids don't, some kids are being raised by grandparents or, aunts and uncles or just maybe parents who, aren't quite, able to understand what EDS all entails. And if we could get more kids aware of it, they'd be able to be a more supportive network of kids and friends for kids who are affected in the schools, I think.
That's a really fantastic idea, actually. I hadn't thought of that microsocial aspect, and this is why other voices are so important. That seems like to me, like it's very clear now. I see it, and even like I remember now, like how important my friends were during a lot of these times because I've had friends that left when things got hard, and I have friends who stayed, and that makes a huge difference.
And the ones who stay are true gems. They
Yeah,
truly are. I tell them this every time I see these friends of theirs. I'm like, you guys are great. You really are great. Because yeah, a lot do bail when things get a little crazy or, it's just like, oh man, it's just too hard to be friends with this person. They can't come to parties. And it's, yeah, so some do leave, but some stay. And that's
yeah.
what's important. You had mentioned your nonprofit. Is that the Medical Inspiration Inc.?
That is correct, yes. So
Okay,
that's the
tell us
nonprofit that I
about
founded.
that.
But yeah, so Medical Inspiration Inc. or Incorporated is it's a nonprofit that I founded a few years ago, really in the idea of how can we provide support in ways that, you know, a microsocial environment would, and how can we try to allow patients to really get to live their lives and like support them in ways possible. And so our nonprofit originally came with the idea of financial support, and so that's what we initially wanted to do. And things have changed a little bit since then. We tried that. We did our pilot studies, and that went fantastic. Patients were, we did subsidization of care, and that was fantastic. It was really amazing to see patients that typically wouldn't have access to the supportive measures of care. So, like things like prolotherapy, physical therapy, that are from an EDS specialist that we collaborated with. Uh, we tried to subsidize a large portion of their care that insurance wouldn't cover, things like that. And it was really good, but it gets a little bit difficult, especially with like tax filing and all those things. So, and especially how is that scalable? Because, we work with one clinician, but how can we work with others? And that became just a little bit more difficult for us because we're a small nonprofit and we don't really have the scalability for that. And so we started thinking about other ways that we could start to make a difference. And so one thing is through education, and that's educational aim is probably where a lot of the work that we do is. And so I try to make sure to go on podcasts and national talks with our nonprofit to make sure that we're educating about Ehlers-Danlos syndrome because I feel grateful to be in a space where I get to learn about this disease every day and I find out a little bit more each time we do an experiment. And though I can't talk about our results specifically, we learn more as a field, right? And so I try to take what the literature has talked about and what these clinicians talk about that I get the opportunity to meet at these conferences and try to really educate on these conditions, whether that's through like movie showings and like talks with the community or, flying out to Amsterdam. I just did that recently and talked at a rare disease conference with Lara Bloom and the Connective Tissue Coalition, if you're familiar with them. But
Get out, really? Oh my
yeah, it was
gosh.
such a
You're a rock
fantastic experience.
star. You really are.
Yeah. But so that's a lot of what I've been doing lately with that. And so we also will have some other things coming up that we'll announce soon. But yeah, that's mainly where we're at now. We're still really small and uh we just try to stay operating every year and try to just work with the community. That's what a lot of our focus has been on. But really funnily, we're also all comprised of like healthcare workers and researchers. So like a medical student, PA, NP, me, and then a few other random people. But yeah, just a lot of people who care, and that's what's really important.
That's amazing. And how old are you now?
I'm 22.
Geez, whiz. And you've done, and you have accomplished all of this, even running your own nonprofit. And I see, yeah, and I do see you out there, giving the talks. And I didn't know that so you were recently in Amsterdam, though?
Yes, in October. So the last week of
Okay.
October, I was in Amsterdam with all of them.
Yeah. I know Lara Bloom, I mean, she's always on the road. I don't
Yeah,
see her sit down or sleep or anything, It's very, very hardworking. And I mean, but that's what it takes, I think, with something like Ehlers-Danlos. It's like sepsis. You have to be out there and keep talking about it so that people get used to hearing about it. I mean, same thing, years ago with cancer, nobody knew what cancer was. Nobody knew what diabetes was. Nobody knew what epilepsy was. And now, you know, we have we have a lot more awareness of those. And I see ours heading in that way. Hopefully, sooner rather than later. And that's kind of leading right into what do you see for EDS in the future? Where are we heading with the research and anybody who's out there feeling at their lowest of their low right now, they just got diagnosed, or maybe they are still chasing that elusive diagnosis, but they're pretty sure they have EDS. Is there hope?
yeah, and though I can't talk like specifically about like what our researchers found or anything like
Right.
that, I can really say that uh, as a field, we've come a long way in these last 5 years. Therapeutics weren't even in the horizon 5 years ago, and now I think that we see that like this could be something that is treated. And like, So when I talk about like the Norris Laboratory, like their work has shown that like, if we can find the pathways that cause this condition, we can treat it with the medication. And like the work that we do like bioengineering work and try to do like scalable manufacturing of patient models. And so like we have a little bit more in-depth podcasts about that, or like stuff if people are interested in learning about like exactly the science of what we do. But the entire point is to try to find exactly what is wrong with these patients and to how can we help them. And that is like a big focus of the field right now, because it's not enough to just know what this disease is. We have to find a way to treat it, because people are dying, people are becoming disabled, and that is unacceptable at this point in time. We've come so far with these other diseases, and we're really just trying to push and find out what we can to try to increase their quality of life in any way possible. And so to the people out there, like I every day I get up, I think about people like you, the people that the times where I was disabled, the people that haven't had these opportunities to do research, and your voices are heard. We hear you, we see you, we feel you, and we try to make sure that we are working towards bringing a world where this disease like isn't the barrier that it once was, and a world where we're not encumbered by the restraints of it anymore.
Exactly. Where we can all excel, because the tricky thing about it too is how we're all affected differently. Even my two daughters, it's sort of like you could take a piece of paper and write down all the symptoms, and then just in two columns, and rip it in half and give one column and one the other column. Totally different symptoms. Sisters affected by the same disease, affected very differently, and that's how it is for all EDS patients. It's such an individualized thing, where it's not only the doctors trying to figure out how to treat the patient, but I think it's also the doctors and the physical therapists and other technicians trying to help the patient figure out also how to kind of like create an environment where we're successful. I mean, that's sort of what I do here at my house. That's what I do with all that swimming I do.
Yeah.
It's, it's my free 2 to 3 hours from pain to be
Mhm.
in the water. And I'm really crabby on the days that I don't get there.
Yeah.
So, but yeah, if we can each figure out how to treat ourselves to be able to excel, I think that's really important. And I also try to come at it too. I've expressed this to our sepsis people that EDS patients are at higher risk for sepsis, because we wind up in the hospital more. We wind up sometimes with tubes, catheters, invasive medical devices that go into the skin. And, it's like our risk for infection is higher. Therefore, our risk to develop sepsis is higher. And I'm trying to sort of mesh those two as well, to also let EDS patients know, and vice versa, and let the sepsis community know too. This is a group of patients we need to be concerned about.
That's extremely important. And not only are we in the hospital more, but also we're finding new evidence that like our immune systems are compromised in ways that normal patients are not. And so that's where research and advocacy line up, right? Where it's like, okay, it's not enough to know it. We also need to disseminate the information about it. And I think that that's where the collaboration is the strongest, because advocates learn from researchers, researchers learn from advocates, and that's where we can make the biggest difference. Sorry.
Yes, no, no, and you know what, that reminds me, because I'm so involved with researchers now and physicians, because they're asking us what we think. And I'm an old dog, okay? I'm 63 years old. I remember growing up in a very paternalistic system of medicine. You went to a doctor, usually a male, and um, and he told you what he thought, and you walked out. You went, okay, yes. You didn't question. You didn't even ask questions. You just went, okay, and here, take this pill or do this, and that's what we did. And that's why it was really difficult for me when I actually started to develop symptoms like back in my teens, and they were mostly GI. and I felt very strange and very different from all my friends. But it's the evolution I've seen in the decades I've been on this planet in medicine, and the way, and I always tell the doctors and the researchers that I'm working with, talking with, or doing, sitting on a panel with now, it's like, thank you for including the patient voices, because they tell me all the time, they said, well, we're finally realizing we can learn a lot from talking to the patients.
Yeah, I completely agree. I think that patient voices are some of the most valuable. And
I think that we're seeing an evolution in medicine where doctors are listening to the patient. They hear us. And what I always tell patients is I think I made a post about it the other day or something on my stories, be as clear as you can be with your doctors, and so that you help them to help you the best. And we could do that. I try to have a sheet, and I know a lot of patients already do this, just with all my concerns written down, because it takes so long anyway when I'm in there with a doctor. They know, they see me coming, and it's like, oh my God, okay, half an hour here at least. But if you have that list, I found, not only do I not forget what I wanted to tell them, but it just kind of helps. Like, I have it down with my GP so well now that it's like a well-oiled machine. I just go in there and check. Oh, okay, did I mention this? Check, and check it all down. And I got my husband, who is also disabled, I got us both out of our GP appointment last week in under a half an hour. And we had 20
fantastic.
issues to bring up. So,
Yeah.
but yeah, I think being really prepared for the doctor's appointments is one way to really help your doctor help you. And with EDS patients, we have a lot of things on our list to tick off. So go in there ready, go in there prepared. My last question to you, it was, I think about people like Dr. Zingman, who's here in Silver Spring, Maryland. And of course, Dr. Bluestein and, Lara Bloom and all of them, they've all studied, they're researching, they're physicians and they're patients themselves. And I would just wanted to know, as we end the podcast, what your thoughts are on that. And, do you have any words of encouragement for teenage EDS patients who might be thinking of following in your footsteps, going into research, going into medicine, going for that MD, MPH? What are your thoughts on that?
Yeah. And I think it goes back to that conversation we had earlier. And so, patient voices are some of the most important, right? Especially in the advocacy space, but even so much more when you're a researcher. Because I think that when we understand the condition, when we know what it feels like day to day, nothing makes me excited to get up in the morning as much as it does to go research. Like, I got back from surgery and I immediately came back to the laboratory because that's my hope personified, essentially, where I'm able to take my hope and my values and what I want the future to be and bring it into real life. And I think that not only is there that perspective of being able to create something tangible with our experiences, but at the same time, we're also bringing our voices with us. So, for instance, in the laboratory, I was the first patient who who had the opportunity to research here, but I wasn't the last, and I won't be the last, because there was another researcher that came after me who had this condition who applied to our internship because she saw the initial story. And when we think about our community, it's not only a way to serve us, but it's also a way to help us move forward. And I think that patient voices are extremely important, and that if you can be the one to make that direct contact, and whether that's you working with researchers as an advocate, as you do, Jackie, or being in research yourself, it can be extremely important, and it can be such a valuable perspective to bring to a laboratory. And one thing on top of that, if you're in research, it's nice to know the clinical presentation of it pretty well, because it's something we deal with all the time. We understand a lot of these things, and it's nice to have a little bit of a background in that.
Well said. Well said. I can tell you do a lot of public speaking and advocacy work, because you're just, you're on it. You are on it. Jeevan. You just come out and you nailed every single one of the points so perfectly. And it was just a great, great thing. I'm glad that you nudged me, like I said, because I've been rather slow as of late getting to my podcast so that, yeah, I actually have a list of people that I'm contacting. And what was happening was every week in my scheduling book, I just kept, okay, rewrite the list on this week so that I can
Mhm.
get to emailing everybody maybe this week. And I want to thank you for kind of, you lit that fire and you got me going back into the podcast. And I really, really appreciate it because it was such a pleasure to have you on here today. I know just your voice is going to help so many EDS patients out there.
Thank you so much, Jackie. I really appreciate it. And thank you so much for having me on. It was a pleasure to get to meet you. I know that like 2 years ago when I reached out to you, I was just an intern and look how far we come. And it's great to
Yeah,
like we got to know each other on social media, but now it's like, okay, I see you. We've had a real conversation now. It's almost like meeting in person and
yeah.
just so amazing. But yeah,
And
thank you
if
so
you're
much for
ever in
that.
the DC area down there with an EDS conference or something, let me know. So I
Will
think I'm
do.
going to meet another sepsis survivor next Monday because she's going to be in the DMV. And I love it. It's wonderful. It's wonderful to see each other on social media. It's wonderful to get people on the podcast. It's even better when we all get to meet in person because it's like, all these minds and all these thoughts and all these perspectives come together and we really understand and we get one another. And I just feel like we can conquer the world when we do that.
Yeah, no, I completely agree. And same to you if you're ever in Colorado or California. Like, please let
Yeah.
me know.
I was in Denver last year just for like a day and a half, but I love Denver. That was
Yeah,
those, I've never seen it, and I never saw those snow-capped mountains like that. It's beautiful.
it is beautiful. I looking outside at it right now. I'm in like an
Yeah.
atrium where we like you can't see the mountains from this area, but you get to see the city and it's beautiful out here.
Yeah, really, truly. Well, thank you
Thank
again,
you.
audience. Thank you for tuning in. And Jeevan, thank you for being here and for coming on the podcast with me. And I want to wish you all the best and all the most, the best of luck with your EDS and with your research and that pursuit of that MD, MPH. We need, like I said, more people like you out there because you have it, you know it, you understand us, and then you get all the clinical knowledge to really help us. And we really appreciate that.
Thank you.
Thanks.
Thank you.
All right. Thanks again, audience. And we will see you. That's a wrap on this episode. We will see you next week or in a few weeks for the next episode, which should be episode 21. Thanks again for tuning in.